this video, I will discuss the bones of the hand in detail. The hand has carpal bones, metacarpals, and the phalanges. The carpal bones are 8 in number, the metacarpals are 5 in number, and the total number of phalanges in one hand is 14. We will begin with the carpal bones. The word carpal is a Latin word which means wrist. Before going into the discussion of the carpal bones, we will discuss the wrist joint. In the wrist joint, 3 bones are involved: the distal part of the radius bone, the scaphoid bone, and the lunate bone. The radius bone articulate with the 2 proximal carpal bones, that is the scaphoid and the lunate bone. And this wrist joint is the condyloid synovial joint. This is the radius bone, and the distal end of the radius bone has 2 articulation surface, and these are for the scaphoid and lunate bone. So the scaphoid and the lunate articulate with the distal end of the radius bone, forming the wrist joint. Now we came to the carpal bones. There are 8 carpal bones, and we have divided them into 2 rows: the proximal row and the distal row. The proximal row has 4 bones, and the distal row also has 4 bones. The bones of the proximal row from lateral to medial are the scaphoid, lunate, triquetrum, and the pisiform. And the bones of the distal row from lateral to medial are the trapezium, trapezoid, capitate, and the hamate bone. This is the scaphoid bone. The scaphoid bone is boat-like in its shape, and this bone also forms the floor of the anatomical snuff box. Next bone is the lunate bone. This lunate bone is curved crescenteric bone and is half moon-like in shape. Both the scaphoid and the lunate bone, as I told you, are involved in the wrist joint. The third bone in the proximal row is the triquetrum bone. The triquetrum bone has a triangular and pyramidal shape. The last bone in the proximal row is the pisiform bone. The pisiform bone is a P-shaped bone, and this bone lies on the surface of the triquetrum bone. Now we came to the distal row. The first bone in the distal row from lateral to medial is the trapezium bone. Trapezium bone is the irregular shaped carpal bone, and it articulates with the metacarpal of the thumb. So it is a way to remember that the trapezium articulate with the metacarpal of the thumb, because both the thumb and the trapezium has an ending with UM. In the trapezium bone, there is a tubercle called tubercle of trapezium. The next bone in the distal row is the trapezoid bone. Trapezoid bone is an irregular boat-shaped bone. The next bone in the distal row is the capitate bone. It is the largest of all the carpal bones. This bone has a head-shaped structure. The head of this bone sits between the scaphoid and the lunate bone. Also, it is the first bone that appears during the development. The last bone in the distal row is the hamate bone. Hamate is derived from the Latin word hamulus, which means a little hook. The hamate bone has a hook on its surface, and that is called Hook of Hamate. A simple way to remember the names of the carpal bone is through the mnemonic "She looks too pretty, try to catch her." In this mnemonic, "She looks too pretty" represent the bones of the proximal row. She stand for scaphoid, looks stand for the lunate, two stand for the triquetrium, and pretty stand for the pisiform bone. These are from the lateral to medial side. Try to catch her represent the bones of the distal row from lateral to medial side. Tri represent the trapezium, two represent the trapezoid, catch represent the capitate, and her represent the hamate bone. Now one thing that you should know about the carpal bone is that both the proximal and the distal row of the carpal bones form an arc that you can see. This is an arc, and above the arc is present the flexor retiniculum. So the arc and the flexor retiniculum create a tunnel called the carpal tunnel. Also, the joint that is present between the carpal bones is called the intercarpal joint. For example, this is the intercarpal joint between the hamate and the capitate bone. Now let's move our discussion towards the metacarpal bones. There are 5 metacarpal bones in one hand. The bones of the metacarpal forms the palm of the hand, and the bone of the metacarpal of the thumb is the first metacarpal. This is the second metacarpal. This one is the third, fourth, and the fifth metacarpal bone. The bones of the metacarpal are present distal to the carpal bones. That's why they are called the metacarpal bones. The joint that is formed between the metacarpal and the carpal bone is called Carpometacarpal joint. The distal row of the carpal bones articulate with the metacarpal bones. The first Carpometacarpal joint is between the trapezium and the first metacarpal. The second one is between the trapezoid and the second metacarpal. Third one is between the capitate and the third metacarpal. The fourth and the fifth Carpometacarpal joint is between the hamate bone and the fourth and fifth metacarpal bones. If we look one of the metacarpal bone as a representative, then this is the base, this is the shaft, and this is the head of the metacarpal bone. The bones of the fingers are called phalanges. Phalanx is the singular and phalanges is the plural. All the fingers has 3 phalanx bone except the thumb, which has 2 phalanx bone. The first phalanx bone in each finger is called the proximal phalanx, and the joint between the metacarpal and the proximal phalanx is called metacarpophalangeal joint. The last bone in each phalanx is called the distal phalanx, and the bone that is present between the proximal and the distal phalanx is called the middle phalanx. The thumb has no middle phalanx bone. It has only proximal phalanx bone and distal phalanx bone. The joint that is present between the phalanx bone are called the interphalangeal joint. The thumb has one interphalangeal joint, while rest of the fingers has 2 interphalangeal joints. Just like the metacarpals, if we look one of the phalanx bone as a representative, then this is the base, this is the shaft, and this is the head of the phalanx bone. Thank you.